Hello and welcome to Medicare Speaking. I am Pragati Singh and you are watching NewsX. Today we are discussing an issue that is so pertinent but seldom discussed about. That is sexual and reproductive health. People are often hesitant to talk about their sexual health, especially when they have to approach a doctor, and many suffer in silence for the same reason. Help our viewers understand, ma'am, how important is it for a female to maintain a good sexual and reproductive health?
So thank you for inviting me and inviting me to uh, give information about sexual and reproductive health. So sexual and reproductive health is important for both male and female, and sexual and reproductive health includes the awareness and knowledge about sexual practices, what is natural, what is unnatural, and information regarding reproduction, which includes fertility issues and infertility issues also. So fertility issues are contraception and if and information about abortion, so unwanted child or unwanted pregnancy, and information regarding the problems or diseases which are spread by sexual contact. So which includes minor infections which can go away with just antibiotics, but also sexually transmitted infections like HIV, AIDS, HBS, antigen hepatitis B. So it includes means very serious diseases also, and these contraception and abortion also can lead to like serious consequences. So it is very important to have knowledge about sexual health and reproductive health.
Okay, ma'am. My second question is, what is the role of a good diet and a balanced lifestyle in maintaining a healthy reproductive system?
So as you know, see, good diet is important for every function in the body. So be it mental function, be it digestive function, be it means the skin, everything needs. So the sexual health also needs good health, and especially because I am a specialist for female reproductive health. So the problems which arise with poor diet are see hormonal problems, and especially which the name is polycystic ovarian syndrome, which is a lifestyle disease which is related to carbohydrate metabolism problems, and somebody eating junk food, more of junk food and more carbohydrates. So these PCOD occurs more in those women who are obese and taking a bad diet or exercising less. And more so, I want to tell you that many cancers, even in men and females, are related to fat intake, are related to red meat intake, are related to obesity. So in females, I would say ovarian cancer, breast cancer, and uterine cancer. So these all are related to obesity and more fats or carbohydrates in the diet, and not taking a proper balanced diet. And similarly, in males also, there are diseases which are precipitated by bad eating habits and other lifestyle like stress and all other things.
Yeah. Every year, about 6% of the adult population in India are infected with sexually transmitted infections and reproductive tract infections. How often should a female get herself tested for the same, and what are the tests recommended? Moreover, what is the best way to protect oneself from such infections?
So see, it is a normal sexual infections are they are very common, and they happen to most of the women would have some kind of sexually, if they are sexually active, then they will have some or the other kind of sexually transmitted infection. It can be just the external infection, that is the vaginal infection or the vulval infection, which is just in the outside. Sometimes it can be internal also. So when it is internal, it becomes serious. Patients can land up into can get hospitalized for because of these infections. So that's why it is and that's why woman needs to know when she should visit a doctor. So if she is not having any symptom, then also she should go to her gynecologist every year. And if she has an infection, if she has discharge, which is foul smelling, which is copious, which is curdy, which is associated with itching. If she has all these symptoms, then she should go to the doctor instead of taking some any kind of desi ilaj or taking medicine from the chemist. They should go to the doctor to because otherwise, if you are in treating the infection incompletely, then you are prone to get recurrent infections. Then also, if you sometimes the infection comes from the partner, so many times we treat the partner also. So if these all things are not taken care of, then you might have recurrent infections and then sequelae of infection, that is infertility, tubal blockage, and many other problems, serious problems.
Hmm. Now, a key factor of reproductive health is menstruation. Very often, girls, especially young, experienced irregular menstruation. What are the basic causes of irregular periods, and can it lead to or be a sign of other health problems? If so, when should one see a doctor?
Yeah. So you are very right that irregular menstruation is also a very common symptom, and patients come to us. I think 50% of women come to us, women and adolescents come to us with irregular periods. The periods can be prolonged, that is happening every 40 to 45 days, 50 days, even 2 to 3 months. And it can be coming very early also. So sometimes adolescent might come with bleeding coming every 15 days, or somebody can come if she's bleeding for like 10 days, 15 days, 20 days, and heavy bleeding. So there are different kind of problems. And yeah, I would actually tell everybody that your periods, if they are coming between 21 to 35 days,
Hmm.
35 days, and it is happening regularly at the same time, 3 to 5 days, I think is okay. You don't need to see a doctor. If you are bleeding for less than 7 days, then, and if your bleeding is not associated with passage of big clots, or you're not having severe pain during periods, which is affecting your day-to-day being, then it is normal. Otherwise, if there is something stray from this normalcy, then you should see a doctor. And what is the reason? The reason many times for adolescents, sometimes their cycle takes some time to regularize. So the doctor has to first get an ultrasound or check what is the problem. And if everything is fine, then we can observe also. We can observe the cycles, or as per what is the requirement. Most of the time it is hormonal problem. Then we can give some hormonal medication also to regularize the cycle.
It is a very important day today. What is your message to the viewers when it comes to discussing their sexual health, considering the social stigma around it?
Yeah, you are right that there is a social stigma around it, and many times the woman and males also, if there is a small something in the genital area, if there's a lesion in the genital area, or there is some discharge, swelling, anything, they don't want to come to the doctor. They want to go to the chemist or ask their friends or something like that, and which can actually make your problem worse. So they should know that it is very common. It is very common. It is not only you that you're suffering. It is very common. So once in a year, I would say it is normal to have like this kind of infection to a married woman. Once in a day, it's fine. You go to the doctor, she will treat you, and it's fine. But and don't hesitate to go to the doctor. It is very common, and uh, sometimes there is also a stigma that nowadays there is also a stigma that how uh, doctor, how did I get it? Should I think that my partner is having infertility issues? So that is also not the case. Actually, it is very common, and many other virus infections are also very common. HSV is herpes simplex, which is also very genital herpes, which is also very common. So it is not because of this. Sometimes the infection just stays there, and when the immunity is low, it just flares up. So we see the infection later, like many years after the infection. So it is there should be no stigma around it. It is very common, and there are treatments which will actually treat you in within few days.
Thank you so much, ma'am, for such an important message. I hope it has been an edifying to our viewers as it has been to us. For now, I would like to thank you for your time, ma'am, and thank you viewers for joining us on this special day. Do visit our website medicallyspeaking.in and follow us on Instagram, Facebook, and Twitter. Thank you for watching.
Thank
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.